Anyone who's been a patient in a hospital or spent any time visiting someone in the hospital knows that nurses are the indispensable backbone of the medical care given there. But should state law mandate how many patients a nurse can care for at any time? Massachusetts voters are being asked to decide that. Question 1 on the November ballot would, if passed, enact a new state law requiring a minimum number of nurses to care for patients. The state's main nurses union, the Massachusetts Nurses Association, worked to put the question on the ballot because it believes hospitals are cutting corners and costs by having too few nurses on duty, a situation the union says comes at the price of patient safety and care. The state's hospitals are strongly opposed to the ballot question. They say it imposes rigid and impractical mandates that will increase healthcare costs and have other negative consequences without improving patient safety or the quality of care. Just how would the ballot measure affect the state's healthcare system? A yes vote on question 1 would require a minimum level of nurse staffing in various patient settings. For the typical medical or surgical floor in a hospital, it would require 1 nurse for every 4 patients. For more acutely ill patients, the ratios would be smaller. For example, it would require 1 nurse for every 3 intermediate care patients and 1 nurse for each critically ill patient in emergency rooms. The language of the ballot question says these ratios must be maintained at all times. That means a hospital floor with 12 patients would always have to have 3 nurses on duty. If a 13th patient is brought to that floor, there would have to be 4 nurses on duty at all times. The ballot question allows for fines of up to $25,000 per day for each violation. How many new nurses would have to be hired? And what would that cost? The State Health Policy Commission, which has carried out the only independent assessment of the ballot question, estimates that somewhere between 2,200 and 3,100 new nurses would have to be hired in Massachusetts. The same report estimates that the ballot measure would increase healthcare costs in the state by $676 to $949 million per year. That's based on several factors, including salaries for new nurses, a projected 4 to 6% increase in all nurse wages because of the heightened demand for nurses, and the cost of developing acuity tools needed to categorize the severity of patients' conditions and determine the appropriate nurse staffing requirement. How would the law affect hospitals here? The biggest impact would be felt by smaller community hospitals, especially those that care for lots of low-income patients who rely on Medicaid and Medicare insurance. The Health Policy Commission report estimates that these hospitals would have to increase their nurse staffing by 21 to 30%. Big academic medical centers, on the other hand, which already have high nurse staffing levels, would only have to increase their nurse hiring by 5 to 7%. Opponents of question 1 say these new hiring requirements at community hospitals and in other settings like psychiatric care facilities will force hospitals to shut down less profitable units and might lead some hospitals to close altogether. Proponents say the new hiring would correct a long-standing inequity, a situation in which hospitals caring for lots of low-income patients have been badly understaffed, while wealthier patients have received care at better-staffed facilities. That still leaves the question of who would pay for staffing upgrades at hospitals that rely heavily on government payers who provide fixed reimbursement rates. Does any other state have minimum nurse staffing ratios? Yes, 1. California passed a nurse staffing law in 1999. Unlike the Massachusetts ballot question, the California law did not specify the exact ratios to be applied. Instead, it charged the state's health department with coming up with the most appropriate staffing minimums. The California minimums are generally higher than those in the Massachusetts ballot question. California also spent 5 years implementing its law. The Massachusetts law would take effect on January 1st, less than 2 months after the election, though the two sides dispute exactly what that would mean. Opponents say hospitals would have to hire hundreds of nurses in less than 60 days, an impossible goal to meet, they say. Supporters of question 1 say there would be a ramp-up phase during which the Health Policy Commission would develop regulations. Massachusetts already does have minimum nurse staffing requirements in one specific setting, intensive care units, the results of a law passed in 2014. What's been the impact of the law in California? It led to the hiring of a lot more nurses. There is plenty of evidence that higher nurse staffing levels are linked to fewer adverse outcomes for patients. But it's not clear that mandating strict staffing ratios will yield benefits, according to Joanne Spetz, a University of California, San Francisco researcher who has studied the California law and who co-authored the Massachusetts Health Policy Commission analysis of Question 1. That's because it's hard to tease out whether hospitals that have higher nurse staffing levels have other qualities that also affect patient outcomes. Spetz told the Health Policy Commission there is no clear evidence that the California law has led to systematic improvements in patient outcomes there. The ballot question here came about after years of unsuccessful efforts by the Massachusetts Nurses Association to get legislation passed to establish mandated nurse staffing ratios. Frustrated by the dead end they kept hitting in the legislature, the union decided to take the issue directly to voters. It's become a highly contentious issue in this year's election. So what's the right thing to do? That's now up to you.